If a patient starts losing less than 4 kilograms per month, then that is the indication to increase the dosage. But at that 1 milligram, if the patient is still losing up to 4 kilograms every month, then the patient can stay on that 1 milligram for as long as is needed. Hello and welcome back to my YouTube channel, Blessing on GLP-1. My name is Blessing. I am on a weight loss journey using the GLP-1 agonist, specifically semaglutide. If this is your first time joining me, you are absolutely welcome. Thank you. And don't forget to subscribe to this channel, share this channel to your community, and help this channel to grow. On this channel, I share my journey on weight loss journey using this amazing medication. And on last video, I was bitter and complaining about how I was on a stall on a plateau. So, and how many days ago was it? 3 days ago, I went on my appointment to my endocrinologist, and I would like to share with you the discussion we had together to create more awareness and more knowledge on this weight loss journey using GLP-1 agonist for anyone that might find it useful, right? And not to do guesswork. Is it this? Is it that? What is working? What is not working, right? So, as I said in my previous video, I was supposed to actually have an appointment with my endocrinologist 4 weeks after my first shot for review and upping my dosage. But she went on a holiday, on vacation, and I did not want to see another endocrinologist, even though the clinic offered. I didn't want that. I just wanted to stick with one endocrinologist, and I didn't want to up my dosage either by myself because I'm very nervous. Not very, but when it comes to health, I try to be careful, right? And I decided to just buy the 0.25 and continue using, which pissed my endocrinologist off when I saw her the last time. And when we were talking, I actually remember, or I think I remembered her talking about upping. She's like, "Oh, you could have just upped the dosage yourself." So basically, she told me this, that 0.25 is not treatment dosage, right? It's not a treatment dosage. It is a starting dosage. So even though I did lose weight on 0.25, it's not meant to be a treatment dosage. And that is why I had a stall. I lost 6 kilograms in the first 4 weeks and lost 2 kilograms in the remaining 3 weeks, right? Just 2 kilograms. And I felt like I was struggling to lose those 2 kilograms, even though I was doing everything right. She's like, yes, that is because 0.25 is what is meant for diabetics, right? To reduce the blood sugar. It's not meant to be a treating dosage or, yeah, a treating dosage for losing weight or losing fat, right? So I asked her, does it mean that it reduces my blood sugar since I'm not diabetic? She's like, no, that this is a smart medicine. That if it goes into the body and there is no, it realizes that the glucose level does not need to be reduced, it does not reduce it. It does not do any of that, right? But the implication for me that my aim is to lose fat, lose weight, is that I won't be able to move forward comfortably on that dosage. And that even 0.5 is still not a treating dosage, but it's still better than 0.25. That the treating dosage is from 1 milligram, right? And out of etiquette, they are required to increase the dosage of a patient by 1 point, by, yeah, by one stage, right? Not skipping dosages. So that's why she told me that after the first 4 weeks, that's the first pen of 0.25, I should have moved to 0.5. And then after 4 weeks, I moved to 1 milligram. Then it is from that 1 milligram that it's now checked if the patient needs their dosage increased, depending on if the patient starts losing less than 4 kilograms per 4 weeks per month. If a patient starts losing less than 4 kilograms per month, then that is the indication to increase the dosage. But at that 1 milligram, if the patient is still losing up to 4 kilograms every month, then the patient can stay on that 1 milligram for as long as is needed, right? So zero point 0.25 and zero point 0.5, it still needs, a patient still needs to move up the dosage, even if it feels like they're losing weight on there, because that is where all the plateau starts coming in and everything, right? So I asked her, what if now that I am more active, that I felt more hungry in the past 2 weeks, I felt like I had to use more of my free will to not overeat or something. And she told me, like, no, that is because I was on that dosage that I'm not meant to be on, and that my calorie intake is perfectly normal. There is no need to increase it. And I agree, because now I am on zero point 0.5, and I feel myself the same way I felt when I started on 0.25 the first 4 weeks. So no, my calorie intake did not need to increase because I became more active. I just needed to increase my dosage to a treating dosage for weight loss and fat loss, because I was still on the dosage for diabetic patients. Now, I have one more shot of 0.25 in my fridge, which I haven't used, and I don't know when I'm going to use it because I am now on zero point 0.5 dosage. So that is how it went. And now I'm back to my normal self. And on Saturday, I'm going to measure myself, but I'm already positive. I can feel it in my body that I've started losing weight on the rate that I'm supposed to again, you know. And I'm quite excited to take my next scale measurement. And I'm going to give you guys my week 8 update. And it's going to be more positive than my week 7 update that I was feeling so down, right? So if you're on this medication and you're doing it with a doctor like me, try not to skip your doctors. I did skip it though. I did skip it because I wanted to, but out of, she wasn't there. But do listen properly, because now that I remember it, during our consultation, she did actually mention that I need to move point 0.5, but she did also say that I need to come for consultation. So I assumed that I needed to consult her before upping my dosage, which I didn't need to. I just needed to consult her for us to have an update on how things are. If she asked me a lot of questions, did I feel any scratching on my skin? I guess that's to check for allergies. Did I feel nauseous? Did I feel did I have diarrhea? Did I have what is the opposite of diarrhea? Did I have constipation? Um, she asked me all those things, right? So those were actually to see if there is a need to recommend some sort of tests for me to do to know the level of things, right? So that's what the consultation was for. So do listen to your doctors when you're in consultation properly, and don't elongate things and complicate things for yourself if not necessary, right? And yeah, she did write me some tests, because I told her that when I haven't eaten for up to 6 hours, I start feeling, you know, I feel as if I'm having a heartburn, but it's not a heartburn, it's more on my throat. Then I need to drink constant water. So she did write me some tests I need to take, but she said it's not urgent. I can do the medical tests before my next visit to her next month. So, yeah. And as I said, now I have 0.25 in my fridge, and I'm feeling so sad because I think I might end up not using it anymore, because the instruction says once you open it after 6 weeks, you can't use it. And I don't see myself using it in the next 3 weeks or so. So there you go. But at least it's just one more shot remaining, right? It's not like 2 or 3 or something like that. And I'm so happy to go to the normal dosage I am supposed to be on. Right. Write in the comment section your own experiences on these things. If you ever saw a doctor before starting your journey, what was the doctor talking about? If you are doing it by yourself, at what stage did you know to increase your dosage yourself, except that you read the instruction manual? Because in the instruction, it's actually written like the same way. I actually got myself to read the whole thing by myself after I've already gone to my doctor, and it's actually written that way. You take the 0.25 4 weeks, and then you go on to the zero point 0.5 and then on to the 1 milligram. But I'm always excited to read all your comments. And for those who have been commenting so quite often, I see you, Reiki, right? I hope I'm not mistaken. Forgive me if I am. I'll look it up and write the right name. I'm so grateful for all your comments. You really calmed me down when I was in the last two videos that I was complaining a lot about not losing weight as much as I was the first few weeks, and all the discouragement. So I really appreciate you. Like this video, please share this video to your community, and till next time, see you. Bye bye.